Deepika Grandi, representative for Cleveland Clinic in India, founder and director of IMAS Healthcare. Today, I'm truly honored to introduce a remarkable individual whose expertise has had a profound impact in the field of heart failure. Dr. Starling, a distinguished cardiologist and renowned authority in the field of heart failure from Cleveland Clinic, is among us. Welcome, Dr. Starling.
Welcome, happy to be here.
Dr. Starling was appointed to Cleveland Clinic in 1995, and since then, he has served in several leadership positions, including being the past president of Heart Failure Society of America. He has cared for over 1,200 cardiac transplant patients and more than 500 patients with ventricular assist device. Dr. Starling has been principal and co-principal in several trials. He has published more than 350 peer-reviewed articles and authored several textbook chapters. He has served as an editorial consultant in ABC's 2020, CNN's Heroes in Medicine, and several PBS televised programs. It is an absolute honor to welcome you to India, Dr. Starling. So, Dr. Starling, what brings you to India this year?
So I'm in India on this trip because of my relationship with Dr. Arvind Bimraj and the organizers from the Heart Failure Foundation that have organized a 1.5-day meeting dedicated to heart failure and specifically to advanced heart failure. So I was very fortunate to be invited to participate in this meeting.
Any positive experiences from your stay in India so far?
Well, I think what I always enjoy when I come to any different culture outside the US is the opportunity to interact with the physicians, because it expands one's horizons to understand the culture and the practice of medicine in other parts of the world. What has always fascinated me when I have been to India, and this is my 4th trip to India.
I didn't know that.
Yeah, this is my 4th trip to India, is the level of sophistication of the medical practice here, I think is the same as the US. The difference relates to some economic factors and access to certain technology that's not feasible in India, that's more commonplace in the US.
Thank you for sharing those insights as it relates to the variations and similarities in practice between India and the United States. Dr. Starling, would you like to share anything with the audience here and for our healthcare community that's perhaps not listed in your bio? Any interesting fact, any hobby?
So we don't have enough time to go through all my interests and hobbies, but the one thing that I'll mention that is aided by a lot of international travel, I think I could describe myself as a foodie, and in that context, this is a wonderful opportunity for me to have exposure to Southern Indian cuisine while I'm here.
That's great to know. So you must have already tried chicken tikka. That's what Indian food is popular for in the Western world. But have you tried any South Indian food in the last 2 days over the conference?
Well, you'll have to educate me on that. So I did have some chicken biryani, which on a trip to Hyderabad a few years ago, the host took us to a very, very elaborate dinner, and he said, "Forget all this other food. I just want one dish of chicken biryani."
Wow, I'm so impressed with your pronunciation of biryani, and your bang on. Hyderabad is known, and it's very special for Hyderabadi food, and that's where I'm from. Let's delve into heart failure program at Cleveland Clinic. What makes it unique as it relates to many other programs around the world?
So what makes the Cleveland Clinic Heart Failure Program unique, I think, relates to, one, its size and its breadth. And in that context, the Cleveland Clinic main campus does over 60 heart transplants per year. We do close to 100 LVADs a year. So we have a great platform for training and education. So one of the things that I was able to do when I came to the clinic was to start an advanced fellowship to train physicians to be heart failure specialists. In fact, Dr. Bimraj, who you met, who's from your hometown, was one of my fellows about 15 years ago. So I think what is truly unique about our program is that 25 years later, there are physicians all over the world that trained with us in Cleveland, Ohio, that are kind of disseminating the best practice, but they're also disseminating further education. There was a wonderful session here this afternoon that was all about how do we expand the heart failure specialists in India.
Well, thank you for sharing those insights, and we are so fortunate to have your pearls of wisdom and your expertise as we expand the management of heart failure in India. In terms of innovation and technology, are there any specific innovations that have originated from Cleveland Clinic that has improved heart failure practice?
Well, of course, there's probably too many to mention, but the ones that I would highlight are transplantation. So Cleveland Clinic was not the first, but one of the first to do heart transplants, which was over 50 years ago. But the current heart transplant program was restarted in 1984. And since that time, we're unique in that we've done over 2,200 heart transplants. And in the context of all those transplants have been many clinical trials, leading to revisions in the immunosuppression that is used. So I think one would be expertise in transplantation, and indeed the Cleveland Clinic has one of the best, if not the best, 1 and 3 year outcomes as far as heart transplant. There's a long history of innovation in mechanical circulatory support, including the development of a total artificial heart, which is not used in humans at this time, but a lot of bench research and testing. We've also been at the forefront of many clinical trials that have led to, for example, the drug class that is referred to as angiotensin receptor neprilysin inhibitors, which is now disseminating across India. We were at the forefront of those clinical trials at the Cleveland Clinic.
Well, you're absolutely right. I think the list goes on, and that's what I've been hearing in this conference as well. Thank you again for sharing and identifying some of the top innovations. Digital health and AI have become the buzzwords post-pandemic. In your opinion, what are the real opportunities of incorporating technology in the management of heart failure patients?
That's a really good point that you raised. And I think in the context of the pandemic, a lot of this has accelerated. So what do I mean by that? So we have devoted a segment of our practice to population health. So what this means is we're looking for ways to extend our reach to populations versus one single patient. How are we using artificial intelligence right at this moment? One way that we're using it is to go into large databases in our electronic medical record to help us identify patients, one, that are suitable for clinical trials, but we're also using it to identify patients very quickly that may be candidates for advanced treatments like mechanical circulatory support. I think somewhat related to AI is the use of various electronic techniques to extend our reach remotely. So the whole area of, if you asked me 5 years ago, could I do a consultation with a patient in another state or in another country? The answer would probably be no. Now it's commonplace. And all of this has accelerated during the pandemic.
Well, I think patient is, at the core of what we do at Cleveland Clinic, and I'm so elated to hear that ultimately the technology and AI that we use has a positive impact on patients. What's your advice for a patient who's been newly diagnosed with heart failure? Given the spectrum of treatment options that are available today, whether it's medical management or interventional management, what are your suggestions for how does the patient navigate as to what's the right option for him or her?
That's also a very important point and also a challenging one. So I made a comment this afternoon that the most exciting part about being a heart failure physician is having the knowledge and the tools. I refer to myself as an architect, not necessarily a doctor. And what I mean by that is I can take all the resources of the Cleveland Clinic, all the expertise, Dr. Kapadia in interventional cardiology, Dr. Wozni in electrophysiology, our fantastic cardiac surgeons. So you come to me on day one and say, I have heart failure. That's a very broad, vague. So a patient really needs to get themselves to the best physician who has knowledge, who has resources, who has the expertise to drill down to make a very specific diagnosis, to understand if that patient just needs treatment with medical therapy. Does that patient potentially need surgery? Does that patient potentially need a pacemaker? So many of the consultations that we see, all of those categories, and this is referring to people in the United States that have self-initiated a second opinion. Many times they're not adequately treated, and opportunities to reverse their heart failure, I will not use the word cure, but we'll use the word remission, are plentiful. So on an average week in my clinic, I see many patients that presented with severe heart failure, with weak hearts, that over the course of 6 to 12 months with various treatments are almost normal again. That's very exciting.
It is. So I don't know if you remember, but during COVID, you had offered a peer-to-peer consultation via our telemedicine practice for a couple of patients in India, and they were very appreciative of your guidance. Thank you so much for sharing your wealth of wisdom with our healthcare community, and I hope you have a very good rest of the trip in India.
Thank you so much.